Let's talk about something a little more lighthearted, potentially equally as important. And that question is, how do you pick your OBGYN? Is the doctor that delivered your baby the same one who should be removing your endometriosis, your endometrioma, fixing the prolapse? Did you know that we also have subspecialties and other areas of interest? Let's help get rid of some of that confusion, and so you can find hopefully the best doctor, OBGYN, GYN for you. So as OBGYNs, traditionally we took care of everything in women's health. That is one of the most attractive things about what leads us to choose this specialty is the very diverse amount of things that we do. However, when we are continuing to push for excellence in each aspect of women's health, it led to further subspecialization. And that actually happened quite recently. It was the 1960s, 70s, where the field of OBGYN started to recognize certain subspecialties. This started with maternal fetal medicine, or the doctors that take care of high-risk pregnancies. And then we developed GYN oncology, which became recognized in the 70s to take care of the gynecologic malignancies, a lot of what we're talking about this month. So there's been a lot of changes over the years, and so let's talk a little bit about that. My name's Eric Schmidt. I'm a board-certified OBGYN, minimally invasive gynecologic surgeon. It's September, which means Gynecologic Cancer Awareness Month, and for that, I want to do a fundraiser. This is day number 5 for fundraising so we're going to be fundraising for gynecologic cancer research. There's a link below with a GoFundMe. Any little bit helps, so if you are able to donate, we thank you very much. But back to the video. Again, so there's multiple subspecialties when it comes to our field. There's maternal fetal medicine, there's gynecology, oncology, and a newer subspecialty over the last decade or two is called urogynecology. These are our colleagues that take care of a lot of incontinence issues, whether medically or surgically. Prolapse issues is kind of the mainstay of their subspecialty. But now there's further subspecialties into things like minimally invasive gynecologic surgery, which is kind of the space where I do a lot of my things. There's family planning. There's reproductive endocrinology, that's infertility medicine. And so that's like IVF. And there's, again, further trying to push forward and excel in certain areas of women's health to hopefully not only have better outcomes, but better patient satisfaction and better experiences. There's so much new research, there's so much innovation, there's so much more surgical techniques in each of these specialties where the general OBGYN just can't do all of that and excel at all of it as much as we want to. So I'm going to draw a picture to help illustrate how someone can pick the right OBGYN for them or know the right questions to ask. And just a reminder, I'm speaking very generally. I don't mean to offend anybody. There's the OB circle, and the GYN circle. And so the OB side of thing, obstetrics, that's pregnancy-related care. The most OBGYNs are very versed in obstetrics coming out of their residency. And also a lot of OBGYNs like doing general gynecology. This would be like contraceptive management. This would be procedures like tubal ligations. This would be procedures like hysterectomies or myomectomies. And so a lot of OBGYNs do occupy this space here. I would say give or take 90%. But there are, again, with certain preferences and doctors having their own preferences, some people are gravitating to mainly only seeing pregnancy patients, and colleagues in their office might do more of the complicated gynecology, and that's a little bit how my practice currently is. Some people choose to only do this. We call those people that work on labor and delivery laborists. So we'll put them in this little bubble. And then we talked about the other areas of subspecialties. So the maternal fetal medicine would be a branch of somebody that is choosing to mostly do obstetrics, specifically high-risk obstetrics. I wasn't sure how to completely classify REI, whether I'd put them on the GYN or the obstetrics side, so I'm going to make them their own little bubble out here. They're the infertility doctors. Again, they mainly stick within their sphere of care. And then we have like the family planning, which deal a lot in contraceptive access to care for a lot of patients. And now, over the years, again, there was more subspecialties for the gynecology side. There's the oncology sphere. And so that's an additional fellowship, just like the maternal fetal medicine and all these other ones are, to take care of things like endometrial cancer, cervical cancer. The way that the gynecologists and oncologists work is like, for example, for abnormal pap smears. The gynecologist is often working up abnormal pap smears, doing the colposcopies, doing the LEEP procedures. And if at some point cervical cancer is detected, usually that consult is made over to the oncologist to further manage it there. And in the field of gynecology, oncology is an additional 3-year fellowship, just like maternal fetal medicine, but more surgically inclined, I would say. They have very difficult surgeries with ovarian cancers, cervical cancers, and so sometimes if there was more complicated gynecology, they would send that, even benign, to the oncologist. And so that's where my sphere kind of came from, is the MIG sphere, okay? These are providers that are usually choosing to exclusively work in gynecology, specifically the surgical gynecology for benign indications, so not the cancers like we've been talking about over the last few days. Usually giving up the obstetric side to focus more on things like endometriosis, maybe fibroid care. And while a general gynecologist certainly can do surgeries like this, but if you're seeing somebody that, and you want to see somebody for things like endometriosis, things like fibroids, if somebody mentions they have an interest in minimally invasive gynecology, sometimes that is a little bit of an inference that they have a little more, at least higher volume, and maybe expertise in this area. And then another bubble, that's a uro, and this is things like prolapse and incontinence. So again, you're trying to find the right doctor for you. There are, again, OBGYNs, general OBGYNs, that also deliver your baby and also are very up to date on taking care of things like endometriosis, taking care of things like fibroids. But it's something you might want to ask them. And things that can clue you in is, do they have any additional board certifications? Do they have on their bios that they have interest in endometriosis, fibroid care? And kind of a big clue is if somebody is wanting to be seen for endometriosis, fibroid care, if somebody is saying they like taking care of that, especially if they've given up the obstetric side to focus on that, that might be a clue that that's potentially the person for you for that care. I thought of another one I want to add: menopause. So menopause, you can't read it because I scribbled, but unfortunately, traditionally, not a lot of gynecologists or OBGYNs, it's just the truth of it, go into the specialty to take care of menopause. They go into the specialty for the obstetrics, the surgical gynecology. Not a lot of people, when they're young, are saying, I want to be an OBGYN because I want to take care of menopause, at least from our generation. However, with the recent light of how much of a need there is, again, if you're going to your doctor and you're feeling like your symptoms are being dismissed, you're not getting answers or treatments or the recommended treatments for things like hot flashes, night sweats, brain fog, and you're kind of getting the workaround for menopause treatment options. Again, not all gynecologists are versed in menopause or feel comfortable with it, unfortunately. And so looking for somebody in their profile, where they're saying, I'd like to do that. Or what you can also do is go to a couple websites. One, there's a NAMS website, North American Menopause Society, where providers list their information to let patients know, hey, I'm interested in this. Come see me if you're having this issue. Another website to look at if you're looking for menopause or sexual health information is ISSWSH, ISSWSH. It's International Society for the Study of Women's Sexual Health. Sorry, I always forget the full name for that. But yes, IshWish is also a good resource to get information, but also find a provider for you. And for endometriosis care, there's like Nancy's Nook, or there's a lot of Facebook groups or things like that on social media to try and help you find the right person for you. So coming back to the main question, is every OBGYN going to take care of every single issue? No. Is the general OBGYN going to take care of everything? Potentially. However, if they are listing that they like certain areas or have certain interests, and having interests is good. Focusing on a certain area really well is really good for driving that part of that surgical, or sorry, not surgical specialty, but specialty forward, and hopefully improving not only outcomes, patient satisfaction. That is all a very good thing as we look to make women's health and healthcare better, as it needs to be better. So I hope that answers some of those questions. I hope I didn't offend anybody. Yeah, again, this is a fundraiser video. Link below. If you are able to donate, please do, for women's cancer research. And hopefully we can continue to drive that forward, because we all know we can't depend on the government for research anymore. And so we have to do that ourselves.